We all know that all injuries and illness are not the same, so the approach to treatment should be different too. Today we're going to learn about the services offered at Norwalk Hospital's FastCare clinic. Joining me now is Dr. Michael Marks, the Vice President of Business Development. Nice to have you here, Doctor. Tell us about the retail center.
So this is the first retail health clinic in the state of Connecticut that's associated with the hospital. So we're very excited about it. And really what we're trying to do is we're trying to bring health care to the consumer where they spend most of the time.
And it's a retail care facility because it's inside the store.
Correct. It's actually inside the Stop and Shop and in Fairfield at Kings Highway Cutoff. And we know that families go to the supermarket 2 to 3 times a week. And for a lot of them, they need to get medical care taken care of, and now we're making it convenient for them.
Yeah, one-stop shopping, right? You get done.
Absolutely.
So talk to me as to when we need to go to a retail care center or see your primary care physician, or when you really should just go to the emergency room. How do we determine that?
So ideally, it'd be great for the individual to go to a retail health clinic when they don't have another choice to get done. Primary care should always be their first choice, but it may not be convenient for them. It needs to be affordable. And so we've come up with one-stop shopping for this. It's $82 for your clinic visit. No
matter what? Whatever.
No matter what. All insurances are acceptable. There may be some additional costs for some in-hospital lab tests that need to be done, but simple basic lab tests like a monospot test or a quick strep test are all included in that same price, because we really want to be another touch point for the patient in the continuum of care.
Sure. How is the FastCare clinic staffed?
So it's staffed with advanced practice nurses or physician assistants who are overseen by medical directors with both pediatric and adult supervision.
All right, and this is something you need to call ahead of time? Do you need an appointment?
Don't need any appointment. It's all walk-in. And you're going to come in, you're going to register. If the clinic happens to be busy at that particular time, we're still going to have you register. And just like a lot of restaurants do, we're going to give you a pager. We'll let you keep on doing your shopping. The pager will go off when we're ready to see you. So again, we're trying to make it efficient care for you and your family and help you out. And in fact, it's coming to the summertime, and we know that a lot of people are going to need camp and sports physicals.
Right.
And so we actually have a special promotion coming up. So rather than the normal $82, it's only $45 in order to get one of those physicals, because we know how important those are to the families.
And how convenient. You can continue your grocery shopping while you wait.
Absolutely.
All right, Doctor, talk to me a little bit about some of the common illnesses that you see.
So these are the common things that you may have: some allergies, some rashes, some simple sprains and strains. We really don't want you to show up if you're complaining of chest pain and having a heart attack. But
that might be the ER visit.
That may be the ER visit. But if you're showing up and you have those things and the clinic is close there, go into the clinic. Let them call 911 for you. But we're not going to treat you there. We're going to triage you and get an ambulance to come see you.
Okay. And do you need a primary care physician to go to the clinic, or how does that work?
You don't need a primary care physician, but again, as I said, we want to be part of the care continuum. So when you leave, we will ask you when you've come in who your primary care physician is, so that note will be sent to your doctor to let them know that you were seen at the clinic for what condition and what was done for you. And it turns out that 40% of patients who do have these clinic visits don't have a primary care physician, so our job is to get you hooked up with a primary care physician.
Very good. And you talked briefly about insurance, but most insurance companies
we will accept all insurances, Medicaid, any of the major insurers, and if you only have cash, you know exactly when you come in what it's going to cost you. It's going to be $82, unlike a number of the urgent care centers that charge you an emergency room copay. Where's an urgent care center good for you? It's good when you've got something more severe and you say, God, I really don't want to be going to the emergency room. But there's a huge differential between having to pay $150 or $200 copay for an urgent care visit.
You know up front what you're going to be paying. That's
Absolutely.
Great. And talk to me about the hours when we could stop in.
So we are open right now, and I have to check this all the time, I think from 9 to 6. Monday through Friday. We also have extended hours on Saturday and also on Sunday, and we will be expanding those hours so that we're open till about 8 o'clock at night. Our goal is to be open a half hour after the store opens and close a half hour before the store closes. And we're open every day but Christmas.
Very good. Very convenient, right?
Convenient, cost-effective care where patients need it and where they can get it.
Very good, Doctor. Well, let's put the information up on the screen about Norwalk Hospital's FastCare Clinic. You could visit them over at norwalkhospital.org/fastcare or call 203-255-7940, or really just stop in, right?
Just stop in, even to go inside. And in fact, what we do have at all of our clinics are these convenient little wallet cards, which on the inside give you all the conditions that we're able to treat you for, along with on the back all the hours. So we've been handing these out in the town of Fairfield and around, and they're available in the store. And we've had a lot of people who are really happy that they've got another alternative to healthcare delivery.
Very good. Thanks for being here, Doctor.
My pleasure.